Hey there, in this video I want to talk about swollen knees. Hi, welcome back to my channel. This is Obun Wei, your exercise physiologist. So some people has been asking why is there swell in the knee? Why is there water in the knee? Well, the thing is that especially when it comes to what you think it is, you think that it's water, it's actually swell, and this is actually a chemical reaction that's happening around the knee because your body is trying to heal that area. Okay, so usually in acute injury where you strain or you tear something, right, what your body does is that it releases chemicals around the area and it tries to heal you. The problem with this is that your body doesn't know when to stop because it still senses this and it continues to give off this chemical, and it's kind of like a spam. Okay, it just keeps spamming this chemical at that area, and over time your knee is going to swell up. Okay, same thing for irritation. Sometimes it's just dull pain and achy and all this, but you do not do anything on any change to it. Okay, over time it becomes too much because the root of the problem is not sorted out. It becomes irritation and the swelling begins. So when you see swollen in the knees, there's actually something that you can try to do it on yourself to make sure that it's actually a swell. Okay, one is by visual. You can compare it with the other knee, alright, to see whether it's swollen or not. The other one, which is something that I want to show you, alright, this is something that may be helpful so you can learn and watch what happens. Okay, first off, I do not have a swollen knee, so what I'm going to show you is something as of normal, and this is what you will see. But if you're seeing something different, then yes, you have a swollen knee. Okay, so there goes. Alright, so this is a normal looking knee, okay, and in a relaxed position, okay, and this is tensing up. So what you want to do is to relax, okay, check on your knees, right? So visually both should look the same. Alright, so say if you want to check on the knee that is swollen, what I want you to do is to relax, okay, and use one hand to kind of push all the fluid, or you think there's a fluid, down to your knee. Okay, in normal circumstances you wouldn't see any residue, alright, everything will just be as per normal. For swollen knees, okay, whenever you do this, okay, pushing down, okay, there will be fluid, okay, all the chemical that will kind of get stuck around the knee, and when you remove, you can see the puffiness, and then it slowly goes back to this area. All right, it will start to go back to this area. So when you do this push, you're trying to compress all the fluid together around this area, if there is. All right, and then when you let go, you see the puffiness slowly goes away, the fluid trying to go back this way. Right, so that's how you check yourself if you have a swollen knee. So that's actually how you can do a self-check, a visual one, and then just using your hand to try to push. Okay, so remember not to tense up. All you want to do is to check whether there's really fluid over there, there's water over there, okay, whether it's swollen. Okay, and remember, if you do find it, remember to rise. Okay, rest, ice, compress, elevate, these are very common things. So rest, I don't have to talk so much about it. Ice, you want to ice it for about 5 to 10 minutes every 2-3 hours. Okay, compress, if you have a knee compression, a gear, you can actually wear them. Okay, elevate, you can do it throughout the day, even at work. All you have to do, or what you can do, is to actually place it on another chair, right, so that the fluid doesn't get stuck there. It's actually staying at a horizontal plane at least, okay? And when you sleep, you want to raise it higher, okay, which is above your heart. All right, so you can put a pillow or bolster below, and that's it. All right, but if this continues, okay, you may want to get someone to check on you, because there may be more things happening there. So try to find out the root of the problem, okay, get it sorted out, because this thing will keep happening. No matter how many times you iced it, it just comes back. So if you have a swollen knee, there's basically nothing much that you can do other than going for a rise, okay? So keep doing that until the swell is gone, okay? So if nothing has actually happened, all right, then that's it. Your swelling may be a one-off, so you don't have to worry too much about it. But if you tend to see this as a recurring problem, then there is something that you need to sort out. And before you go and see a professional, make sure your knee is not swollen as well. And here's the reason. When you go and see any professional or healthcare professional, what they want to do is to get the swell away as well. Okay, so you may go down with a wasted trip, right? Because there's no test, there's nothing that they can be done to help find the root of the problem. Okay, the thing is that the swell may be giving you the pain, and when the swell is gone, you no longer feel pain, and then you won't go back to them, right? The thing is that if you have found something and you always feel something around the knee, all right, get the swelling out of the way, all right? Make an appointment, go and see them, okay? And what you want to do on that very day is that you make sure that your knee can move properly, can function properly, so that they can have a good check, okay? They can't check your knee properly if it's swollen. This is the very main reason before you go and see a healthcare professional, right? So get the swell down, then go and do your visit. All right, so that's all I have for you. This is what you need to take note of. Don't make a waste trip, don't pay your money for nothing. You can ice it yourself, do it at home. All you got to make sure is that you do the rise properly. All right, so please take care. If you have a swollen knee, don't play around with it, okay? Don't take it that there's nothing, right? There may be a hidden problem that you are not aware of. All right, please take care, and I'll talk to you soon.